we see complex patients as well as physicians do. So sometimes there's more than one organ involved.
Yeah.
There's more than one system involved. So having that blood work helps us.
Yeah. Yeah.
But, obviously traditionally there was no blood work. So you would go with their tongue color, the way their tongue looks, their pulse, and then the patient's symptoms. And then you would base your either herbal formula or acupuncture on those things.
Okay.
One thing that is really interesting, both Chinese medicine and Ayurvedic medicine, the ancient textbooks that say how to treat, they're written with what I would say is humility and with the intention of helping the person.
Uh-huh.
So they would say, for example, patient presents with these symptoms and this kind of constitution. That's probably this disease. Okay. Go ahead and do this treatment. Okay. And then they'll say, if after your treatment, patient has a whole new series of symptoms that are not good, then that means they really originally had this disease.
Okay.
Right.
Okay.
And therefore this is what it really is. And this is what's definitely going to work.
Interesting.
Right.
Interesting.
So there's no ego about it. It's just a matter of fact of diagnosis is hard.
Yeah, sure.
Okay. And we learn from our failures.
Yeah.
More than we do our successes. So when they show us, okay, this is how you treat it. And then if you failed and this is how you failed, then that means it was really that.
Yeah.
Right.
Yeah.
And the more you understand your failures, the more you understand how the human body works. Oh, goodness. What an interesting question. Thank you for having me on the show and for this interesting question. Well, I mean, my mom's a dentist. My dad was a pharmacist and he ended up owning a toy store.
Wow.
I just remember, the dining room was where I talked about school. Like my parents put a lot of emphasis on school, good grades, what I want to be when I grow up. It was even at a young age, it was like, I remember being 9 years old. Like, what do you mean you don't know what you want to be yet? Like,
yeah.
So yeah, it was really about that.
What did you want to be when you were like, did you have anything that was sort of floating around in your head when you were young?
I mean, like it was around when I was, I think about 14 years old when I wanted to be a dentist because I would watch my mom doing root canals and working with her hands. And I loved talking to people and getting into their lives. And so that was perfect for me. It was an easy transition. Before that, I liked architecture and I liked the judge part, like being a judge where you have to like be neutral and weigh two things for the, greatest good of all concerned. But then when I realized you have to be a lawyer first, I was like, that's done. I'm not interested. I don't understand this whole thing of being argumentative.
Yeah. I'm the same way. Are you a Libra by chance?
I am.
Yeah, so am I.
Yeah. My oldest friend, he's an Aquarius, as is my son. But my oldest friend, like, he would love to argue.
Yeah.
Like with his wife. Like they both enjoyed it. They would take a position and then defend the position. Right.
Yeah.
Yeah. So I'm about, well, why don't we just get to a place of truth, and I've always find when you've gone through that a lot, the results are it's not this or that, it's this and that.
Yeah, right.
Yeah,
exactly.
Where there's a time and a place where both things are true.
Yeah, I couldn't agree more. I've never been one to sit there and argue either. I'd just, much rather just say, okay, we'll do it your way then. And, if it fails, then, we can go from there. So,
yeah.
I've never been one to take a stand either. So what did you do, after, did you go to college? Did you do that whole road?
Very. Yeah. I went to college and then I went to dental school and then I got a master's in Chinese medicine, then a master's in psychology. So
wow.
You could say I did the school thing. You could.
Yeah.
And I'm actually an advocate of most people not going to college, believe it or not. Yeah.
Well, I mean, some people, that's what they enjoy, right? I never went to college and, I don't think that you need to, obviously, but, some people enjoy it. My sister has been through it, and I got it. She just graduated, I think, finally for the last time, maybe 10 years ago or so, something like that. So she kept on going and going and going. But at any rate, so the Chinese medicine, what made you interested in Chinese medicine, and what types of things did they teach you? Is it like, tinctures and
Everything.
different things that could help, like different natural things that could help different ailments?
So I got into it because everyone in my family is like a doctor or a dentist, essentially. And I was 18 and I had a cold, and I have a neurotic Jewish mother. So she sends me over to the doctor. I go to Kaiser, and the waiting room is filled with sick people hacking and coughing. Right. So I left, because, you're usually in there like an hour.
Yeah.
So I left, I came back, they brought me back, and they gave me antibiotics. And I said, well, this problem's in my nose, right? He goes, yeah.
Right.
I go, well, if it's in my nose, isn't it a virus? He goes, probably. I go, well, then what's the antibiotic going to do for the virus? And he said, well, the antibiotic is going to focus on the bugs in your immune system so that your immune system can now focus on the virus. I said, okay. I told my mom what he said, and my mom is in that age group of you just do whatever the doctor tells you to do. So I took it, I got better. And then, this is before the internet. So I went to the library, looked it up. And even in 1991, we knew you don't give antibiotics for a viral infection. There are consequences to that. So I just remember thinking, these people don't know what the hell they're doing.
Yeah.
And that I wanted to learn something holistic so that when I have my own family, I can help them without doing steroids and antibiotics for every little thing. You know what I mean?
Yeah.
That was my motivation.
I love it. I love it. And it's interesting that you came to that realization, that young. I basically started going down that same path where I can remember probably being like 13, 14 years old. And, we used to drink pop growing up, soda, depending, whatever you call it. And then at one point I said, oh, I'm only going to drink clear soda. So I only would drink, Sprite or 7-Up. And then probably around 15, 16, something like that, I was like, I'm not going to drink any soda at all. And I started going down this path of being healthy. And it's interesting how many people don't necessarily, ever get to that point. And it's interesting
that you're into it.
Yeah. And you were right there as well, starting to make those types of, decisions, at that young age. So was there anything that stands out that you use today on a regular basis that, you learned in those schoolings, like any types of, things that you sort of rely on to stay healthy, or if you feel a cold coming on or whatever it is that you'll do?
So because of the taste of the herbs, I try to avoid taking herbs myself whenever I need a boost, but I do liposomal vitamins like vitamin C, D, K2, and that boosts my immune system. It's essential. We need it. Like vitamin D is a hormone, it's an enzyme, it's a vitamin. It's essential for life. You can't be without it.
Yeah.
So I do go more, I guess you could say, more Western in that context. But I also, so one of the things they in Chinese medical school they teach is philosophy, right?
Okay.
And the philosophy is about being in balance with nature. So if it's cold outside, they recommend eating hotter foods. Right.
Okay.
If your constitution is such that you're more affected by the cold, right? Like there's some people like my son, if it's cold outside or if it's rainy or windy, he's much more susceptible to catching a cold.
Yeah.
Right.
Yeah.
So we make sure he eats hot food. We give him oatmeal. They give that, kind of warms your core. And things like that, if that makes sense. So if it's rainy outside, you eat a little bit more drying foods, things like that. If it's hot outside, more cooling foods, just, that of course is part of me. And I love spicy food. So when it's cold outside, I'm looking forward to just eating that spicy food.
Yeah. I love it. Yeah. Very cool. So you obviously focus on like TMJ and basically ailments from the neck up, I guess you could say. How did you get into that focus? of
Very
things?
much accidentally. I always say that this profession chose me.
Okay.
So when I went into dental school, I wanted to be an oral surgeon because I love surgery.
Hmm.
I was a dental assistant for 8 years before I went to dental school, and four and a half of it I was a surgical assistant.
Hmm.
And when I went to dental school, the first semester, they would show these post surgeries, these post TMJ surgeries, and this is well before I think CAT scans even, where you're looking at this plain film with all these bolts in the patient.
Hmm.
And I asked my instructors, I go, how do the patients function like that?
Hmm.
And they just looked at me and they said, we don't know.
Huh.
I go, what do you mean you don't know? Right. And they said, well, I mean, these people are desperate. They don't have a lot of options. And this is something that doctors do to help them out. And I said, well, I mean, you can't go back once you
Yeah.
put these bolts in and cut them open and they're not the same anymore. How are they like, are they better off? And they're like, eh, like
Oh,
very little
wow.
research on the subject back then. Right.
Wow.
So I was very disgusted with that, and I was very naive. I thought that if you're a specialist, you can't turn down surgeries, right?
Yeah.
But they turn it down all the time.
Yeah.
Like the joke I used to make was if you're a root canal specialist, you can't say, well, I don't do this root canal because it's too hard. Well, they actually do. They just say the tooth is unsavable, pull it.
Okay. Okay. Yeah.
So it does happen, but that was fine. So as soon as I graduated dental school, I immediately enrolled into Chinese medical school.
Interesting. Interesting. And that led you to, I mean, was it, obviously, you had this discussed that that you learned this, that people weren't necessarily focusing in on that specific ailment. Was there something that you thought, like, did you have like a hypothesis or something like that, a theory that you felt like you could help people in that situation better?
No, not at all. I just remember thinking how unscientific it was.
Hmm. Hmm.
And it wasn't based on anything. It was like, and in retrospect, it was like, the surgeons were just doing the best they knew how to do, and the patients were desperate. There was no one to help them, and they're like, I'll try anything.
Yeah.
It was that kind of situation, and I didn't want to be any part of that.
Yeah.
I want to do something that's repeatable and useful. If you think about it, uh, you know, traditional allopathic Western medicine is very much okay. Let's cut it out. Let's put you on medication for the rest of your life. And that's like their methodology,
Yeah.
right? But dentistry is not really like that. Even
Okay.
though
Yeah.
we're a part of Western medicine, if someone comes into a dentist with a toothache, the dentist has to look, and they have to take a history. They have to
Mhm.
take an x-ray to see if there's a cavity. They have to probe to see if there's a gum infection or inflammation. Is there a sinus infection that's pressing on the nerves of the teeth? Is the
Mm.
patient clenching their teeth at night? What is going on, right?
Mhm.
And then once they find out, oh, it's just a cavity, okay, well, let's fill it.
Yeah.
Then let's just fix the problem. And then hopefully the dentist will say then, okay, you need to change your diet, or you need to change your brushing and flossing habits, for example.
Yeah.
So to me, that is very holistically driven, because
Mhm.
you're sitting there, you're doing a proper evaluation on a patient to find out what is wrong with them,
Mhm.
and you go from there, right? And at that point, when someone's got a toothache with a cavity, there is nothing a homeopathic or an herbal remedy or even acupuncture is going to do to resolve in a comprehensive way their cavity,
Yeah.
right? Like
Yep.
some people do acupuncture instead of anesthesia
Mhm.
so that they can, not have to use, a drug to get them numb. And they'll do acupuncture, they'll do the filling, and then they'll take the needles out,
Okay.
you know?
How does the acupuncture work? Um, in like the mouth. I mean, are you actually, are there pressure
No.
points or something like that
Yeah,
that
there
you would?
are, but I would never do acupuncture inside the mouth. I would do it like on the hand
Okay.
or on the
Okay.
foot. Yeah.
So that doing it on your hand can numb, like if you
Yeah.
had to have a filling done.
Yeah, absolutely. It's been done. There's
Really?
actually research on it. People have had arm surgery. Dr. Yoshiaki Omura was the first person in the West to do acupuncture, and I think he did some electrical stimulation. But they did, like, they cut him open with a scalpel, did the surgery, stitched them up, all without any anesthesia.
Wow.
And there's videos, I think it's on YouTube. They've actually done brain surgery on patients with just acupuncture.
Incredible.
Like
I've never heard of that
literally
before.
sawed through their cranium, lifted the lid up, did the surgery, plopped it back in, and stitched them back up.
Wow.
Yeah.
Wow. That's
I think the
incredible.
only area of the body where you don't get good anesthesia from acupuncture is in the gut.
Okay.
Yeah. The
Okay.
intestines, this whole region, because the nerves go every which way
Yeah. Yeah.
in that area.
And are you familiar with how acupuncture works? Like,
Well, I hope so.
yeah. So
So
I'm just curious. Is it, you have to find like a nerve ending? Is that basically what you're aiming for,
not a
with the
nerve
needles, or?
ending, but we say that there is either a life force, chi, or oxygen that moves in meridians up and down this electrical grid that we have in our body.
Sure.
And when there's, for example, pain or an issue, an organ issue, we say that there is either a deficiency or an excess in that area. And so the point of the acupuncture is either to bring energy to that area or
Okay.
to unblock the blockage.
Okay.
That makes sense?
And yeah, it does. And I guess how would you go about determining where you should, for lack of a better way, stick the needles
Yeah,
to
well,
be able to?
that's just memory. That's just training,
Okay.
right? So they teach us how to diagnose what the patients have, the symptoms, and though I mean, I don't do internal medicine in my practice. My practice is on pain and sleep disorder breathing. But if I did, I would love it if the patient came in with blood work, because then I can look at what like the numbers say in terms of which organ is having the problem. Because we see complex patients as well as physicians do, so sometimes there's more than one organ involved.
Yeah.
There's more than one system involved, so having that blood work helps us.
Yeah. Yeah.
But obviously traditionally there was no blood work, so you would go with their tongue color, the way their tongue looks, their pulse, and then the patient's symptoms, and then you would base your either herbal formula or acupuncture on those things.
Okay. Got it. Got it. Interesting.
And
So,
I have to say, one thing that is really interesting, both Chinese medicine and Ayurvedic medicine, the ancient textbooks that say how to treat, they're written with what I would say is humility and with the intention of helping the person. So they would say, for example, patient presents with these symptoms and this kind of constitution. That's probably this disease. Okay. Go ahead and do this treatment. Okay. And then they'll say, if after your treatment, patient has a whole new series of symptoms that are not good,
yeah.
then that means they really originally had this disease.
Okay.
Right.
Okay.
And therefore, this is what it really is. And this is what's definitely going to work.
Interesting.
Right.
Interesting.
So there's no ego about it. It's just a matter of fact of diagnosis is hard.
Yeah, sure.
Okay. And we learn from our failures.
Yeah.
More than we do our successes. So when they show us, okay, this is how you treat it, and then if you failed, and this is how you failed, then that means it was really that.
Yeah.
Right.
Yeah.
And the more you understand your failures, the more you understand how the human body works.
Yeah, I love it.
Sense?
Yeah, it does. It does. And you mentioned like ancient, texts. Are there any texts that sort of come to mind that sort of follow that path that
Well, the first textbook of Chinese medicine is the Huangti Neijing. Okay. It's roughly 2,500 years old. Yeah. But there was roughly 2,500 years of data being collected in China before that. Yeah. So, part of, in China, I mean, it was always been the world's largest population. Yeah. As far as I know. And one of the things that has always been an issue for them is like starvation.
Sure.
right?
Yeah.
And making money in order to afford food.
Yeah.
So a way of life that has been around probably to this day is if I learn something, let's say I learned a technique for diabetes, or I learned a technique for tendonitis or whatever, I would only keep that in my family,
Okay.
so that our generation, my generation, the generation would have money so
Yeah.
that they could survive. I mean,
Yeah.
survival is a real thing, right?
Yeah.
That they had to worry about. So when the Huangdi Jing was made, it was the Yellow Emperor wanted like sort of like an HMO system,
Okay.
because he had the world's biggest population.
Yeah.
How do you organize a healthcare system for the first and ancient largest population?
Yeah.
Right?
Yeah.
You have to have something that's not only effective, but cost effective.
Yeah.
Right?
Yeah.
So they used reusable needles, back then. They used herbs that was in the. I'll tell you something very funny. My very first class in acupuncture school was Intro to Herbology. They just kind of
Okay.
give you the overview.
Yeah.
And mind you, I'm already a dentist, and I'm a tiny bit skeptical, even though being skeptical is not scientific. And they would say like this, like she would say, okay, this is the herb, let's say Fuling or whatever, and then this is the grams that you would use in your dosage. And I just kind of like gave the teacher a little kind of like a snide eye, and I was like, come on, how do we know how many grams it is? Because I mean, in my mind, I'm thinking one plant is not exactly the same as the other
Right.
plant.
Right.
And then, when you're weighing it, how dry is it?
Yeah.
So I was very kind of skeptical about it, right? And she told me in a very straight and matter-of-factual way, she goes, oh, in China, we don't have FDA. So, you know, 2,000 years ago, 3,000 years ago, someone gives 60 grams of this grass to a patient. They die. Okay,
So,
next time we say 30 grams.
yeah. Yeah.
You know what I mean? So that's how she said it. And that's how they got these numbers. They just tested it through testing people.
Yeah. Interesting. Interesting. So let's bring this back over to, a little bit more of your focus in that. And helping people sleep. What are some common things that you're seeing today with people that are, seeking out your skill sets?
So in the context of sleep, I'm treating snoring and sleep apnea, both in adults and children. In children, you can actually cure sleep apnea by doing functional orthodontics.
Okay.
And when I came out of dental school, that's what I was doing, even though I didn't know I was doing it.
Okay.
And then the parents would be like, hey, can you help me out? And I would say, okay, I've had this jaw problem. Okay. I'd make them appliances to help with their jaw problem. And they would come back and say, I don't have migraines anymore.
Huh.
And I said, well, good for you. I didn't know you had migraines.
Yeah.
And they would say, no. When I take your appliance out, my migraine comes back.
Okay.
I go, okay. First patient says that, you're like, okay, coincidence. And then I think within a month or two, literally a second patient told me the same thing. And I thought, okay, this can't be a coincidence. So I asked, my study group, and I looked at research, and it's a known thing that both tension type headaches and migraine type headaches can be caused by a TMJ problem. And the reason I say cause, because we're not allowed to usually use that word, because we say it's strongly correlated, as we see it overlap over and over again in multiple studies, thousands of studies. But we say cause because we have data that shows when you treat someone with both a TMJ and a tension headache and a TMJ and a migraine type headache, that either usually the tension type headache goes 80 to 100% gone.
Yeah.
But roughly 50% to 75% of migraines will vastly improve when you treat a TMJ problem, depending on the study you look at and how big it is.
Yeah.
And obviously, and how complex the patient is. That's a whole other issue in and of itself.
Yeah. Now, does everyone who has TMJ know that they have TMJ, or are there some people that don't
I'm
necessarily?
so glad oh my God, thank you so much for asking that question. Thank you. So here's the insidious thing about the TMJ. So we have a mechanism in our brain, in our prefrontal cortex, that doesn't like redundant information, right?
Okay. Yeah.
So, you walk into a room that smells bad.
Yeah.
After about a minute, you don't smell it anymore,
Right.
right? Those odor molecules are still going right up to your nose, right? Olfactory nerves are still picking it up, but your brain doesn't even pay any attention to it anymore because it's not useful information for your survival. Okay. So, and the body, just to be clear, the body is way more concerned about function than it is about pain, because function means survival. Pain you can tolerate and live another day, right? So when it comes to the TMJ, we use it all the time, right? We swallow 2,000 to 3,000 times a day. We chew our food. We talk, as we've been talking nonstop now for how long? And then we go home and then we clench our teeth.
Yeah.
Right. So we don't ever get a break. When someone has a sprained ankle, we instinctively put our weight on the other leg.
Yeah.
We give it a rest. We sit down. We ask our partners to bring us things so we don't have to get up and put weight on it. We can do that with a sprained ankle. With a jaw, we don't get a break. When we have a one-sided jaw problem, we almost always will end up with the other side problem as well. And we don't ever get a break from the jaw. And then if we move to the point of just, acute pain to actual chronic situation, then every time we swallow, every time we clench, that's redundant information to the brain. Even though it's important, it's still redundant. So the brain kind of shuts off the reminder that, hey, you just swallowed, ow.
Yeah.
Hey, you just chewed your lunch, ow. It's not useful.
Yeah.
You understand? And so there's so many people that have other issues like tension type, migraine type headache, facial pain, ear pain, sometimes even tinnitus, and they don't know that their TMJ issue could be causing it.
Interesting.
Right?
Are there any, obviously those are all things those are all signs, but is there anything physically that people can look for, or even maybe a partner, like if they're, sleeping even, again, I'm not sure if it's more prevalent when you are sleeping to have, clenched jaw or grinding teeth.
It is harder. Because your lips are closed, but sometimes when we clench our teeth, we make quite the noise.
Yeah.
But sometimes instead of grinding the teeth, we clench the teeth like this, which doesn't make a noise, right? But puts even worse pressure and pain into the jaw joints than even grinding.
Yeah.
Right. So with snoring and sleep apnea, that's something that's pretty common that the bed partner can see.
Okay.
Right. So they can hear them snoring, they can hear them choking. And actually, we now know that roughly 50% of the time, the reason why we clench our teeth is because of some form of sleep apnea.
Okay. Interesting.
Of course, stress is a factor too.
And you mentioned earlier, that sinuses could even be, wrapped up into this. Does sinuses play a role in this as well?
Boy, you're asking the best questions. It's as if you have a background in this. I love it. I'm being very sincere. I really love your question. So the form of sleep apnea that is more causally related to clenching your teeth is called upper airway resistance syndrome. Okay. And the most common cause of upper airway resistance syndrome is poor nasal flow and then switching to mouth breathing.
Okay.
You follow?
Yeah.
And here's the problem with the jaw. So it's hinged. So when we open, we hinge back and then we glide. That's how the jaw works. Okay. So the first few millimeters of opening, the jaw actually goes back. So imagine you're sleeping backward and your nose stuffs up and then you switch to like that, and then you clench, which can happen reflexively from mouth breathing as well.
Yeah.
Right. But now you're clenching from this retruded position, which is the absolute worst position that the jaw wants. The jaw wants to come downward and forward.
Yeah.
That makes sense?
Yep. Yeah. Interesting. So are there any, I guess, exercises or things that people can do to, help with sleep apnea, or is it you have to get one of the apparatus things. You mentioned that
So
you have, some mouthpieces that you've created.
yeah, we make FDA approved oral appliances to treat sleep apnea. And of course, there's CPAP out there, and
Hmm.
CPAP works. It's not tolerated well.
Hmm.
There are actually three, I think it's up to six now, studies out of Australia. You know the didgeridoo,
Yeah,
that it's
yeah, yeah,
basically a hollow branch, and you brrr,
yeah.
So in order to do the didgeridoo the way Aboriginals do it, you do what's called something called circular breathing, where you inhale through the nose and exhale while holding the air in your cheeks.
Interesting.
You
Okay.
follow? And
Yeah.
that takes a lot of neuromuscular tone. So they've actually have done treatment where they just send the patient to learn how to play the didgeridoo, and then they
Uh,
retest them, and their apnea is improved by 50%.
wow. Wow.
Yeah.
That's interesting.
Same for what's called myofunctional therapy. So a
Mm.
myofunctional therapist teaches you how to properly swallow, how to properly hold your tongue, how to chew, and sometimes how to speak. And that control over your tongue can go a long way in keeping your airway open as well. And on average, it reduces it by number by
Hmm.
50%.
Hmm. Yeah. Interesting. So basically it's, just retraining and strengthening those muscles, to be able to, um, hold itself in place, I guess you can say, when you're sleeping. Interesting. Yeah.
That's right.
What are some of the other, um, common things that people, would complain of, when they have, poor sleep, or when they feel like they're not sleeping well? Is there anything else that comes to mind that people?
So here's the thing. There is nothing that poor sleep doesn't negatively affect.
Mhm.
This is
Yeah.
huge. We have two stages of sleep. One is delta, one is REM. In
Hmm.
delta, we get almost 100% of our growth hormone.
Hmm.
And in REM is where we do our mental emotional processing, right? Plus, we even have studies now that showed that it's during REM, our lymphatic system in our brain is clearing out the beta amyloid plaques,
Hmm.
that can lead to a stroke if you don't do them. So when we don't have growth hormone, first we need growth hormone to grow, but after we're done growing, we need growth hormone for repair.
Hmm.
That makes sense?
Hmm. It does. Yeah.
Yeah. With REM, I mean, who doesn't need mental emotional processing?
Sure.
I
Exactly.
mean, especially during this pandemic where spikes in suicide, depression, anxiety, weight gain, I mean, you name it, everything has gone through the roof,
Yeah.
and everyone has been made to be petrified.
Hmm.
And to be honest, let's be very, very frank here. This pandemic has largely affected the elderly and
Hmm.
the infirm, like
Hmm.
those with multiple systemic issues, at
Hmm.
least three or four, right? And obesity is one of the big ones that
Hmm.
it affects. So the younger age group, the healthy under 50 group, this group from 0 to 50 make up the majority of the planet, and they have an extremely high survival rate.
Hmm.
Right
Hmm.
now, I admit there are, a lot of Americans don't know they have diabetes, hypertension, or even pre-diabetes, pre-hypertension, but they know they're obese,
Yeah.
right?
Yeah.
And when they unfortunately get COVID, they can have a bad outcome.
Yeah.
But the vast, vast majority survive it and have lifelong immunity,
Yeah.
right? So this is, perfectly healthy people have been trained to fear other perfectly healthy people,
Hmm.
in
Hmm.
my observation.
Yeah. Yeah. Do you feel like this is something that people are going to, get past, right? I mean, there's all kinds of, I don't want to go too far down the path of, are you on the vaccinated side, or you're not on the vaccinated side, but, getting over whatever direction you tend to lean, getting past all of that and getting on with life again, I think is, the most important thing that
I
everyone can
agree.
do.
I
I
agree.
mean,
I agree. Well, I'm obviously for choice, right?
right.
So
Yeah.
there's, with the vaccines, there's a risk from the vaccine. There's a risk if you don't get it and you get COVID and have a negative outcome.
Yeah.
So every individual should, in a free society, every individual should have the right to make an educated, me and my doctor decision
Yeah.
on what's best for me,
Right.
right?
Right.
And that's what it's about. If you want to do it that way, just make a choice for yourself.
Yeah. Yeah. No, couldn't agree more.
Mhm.
Dave, this has been a hell of a conversation. There's so much we could dive into, on these specific topics and that, but perhaps we can have you back on again and we can dive into some more of these things. Because
That'd be great.
I could talk about these things all day. So
That could be great.
yeah, no, I certainly appreciate the time. If people want to learn more about you, your practice, your services, what would be the best way to
Yeah.
reach out and get in
So
touch?
I'm very passionate about the subject. So if you go on YouTube, look me up. There's a lot of information. I did a 1 hour Google talk. I hope everyone gets a chance to look at it. And then my website is TMJ LA because I'm in the Los Angeles area.
Mhm.
I have 2 offices, one in Thousand Oaks, one in Los Angeles. Yeah, come look at my website, learn new things, and come and see us if you'd like to help yourself or a loved one.
I love it. I love it. Thank you so much for the time, Dave. And like I said, there's lots to explore here. So
I'd love to do it again.
yeah, I appreciate it. Thanks, Dave.
Thank you.